Welcome to the Group Dentistry Now show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show. I'm Kim Larson. Bill Newman and I are talking about coronavirus disease 2019, also known as COVID-19 today. COVID-19 concerns are sweeping the world since it spreads so easily from person to person and is now considered a pandemic. This rapidly evolving situation is challenging everyone, including the DSO industry. We are speaking today to two leaders from Mortenson Dental Partners about how they are responding to this public health emergency. Bill Becknell is the CEO of Mortenson Dental Partners, a 140-plus practice dental support organization based in Louisville, Kentucky. Bill joined Mortenson Dental Partners in 2014 and served as the Chief Strategic Officer and President of dental teams before becoming CEO. He is the first non-clinician to serve on the board of directors. Dr. Eric Tobler is the National Director of Clinical Affairs, serves on the board of directors for Mortenson Dental Partners, and is the regional president of Stonehaven Dental. He has been practicing dentistry with his family at Stonehaven Dental in Utah since 2007. Welcome to the show. Let's jump right into this, guys. Bill, Dr. Eric, obviously there's a lot of activity in the media around COVID-19. Can you tell us what you're seeing and what plans you have in place to address?
Yeah, absolutely, Kim, and thanks for inviting us to the call. We're honored to be here. You know, it's a pretty interesting and quickly evolving situation. From our perspective at Mortenson Dental Partners, we know we're in the early stages of the outbreak here. We are seeing cases in nearly all of the geographies that we serve, but we are not experiencing any cases in our patient base or team members as of yet, which we're very happy about, but we are fearful that it's just a matter of time. We did spend some time reviewing some industry data that came out of Cleveland research by Jamie Clow, and some of the statistics quoted in this research were pretty staggering. First, dental visits dropped nearly to zero for the term of 30 to 45 days. Elective procedures in healthcare were down 85 to 90%. And just significant disruption in the way of life for everyone for 30 to 60 days during the outbreak. And so armed with that information, we've got pretty busy in terms of preparing for a company, and even saw some more data today that said dramatic declines in patient visits are beginning to occur in Washington and California over the last 7 to 14 days. So very few offices have closed yet, but a few of those have. We've seen directly some impacts here around supply in terms of personal protective equipment. Lots of questions from our team members and patients. We are tracking our appointments and cancellation trends. There's no major factor as of yet in the regions that we are in, but we're expecting that to change. And we're starting to see more cancellations probably next week and increasing no-shows for appointments. We are also thinking that team member availability is on the horizon. We have had schools closed in the regions that we serve. We know that's going to impact a lot of our team members' abilities to get to work. So the situation has escalated really quickly this week. We really kind of recognized we're going to have to be ready to respond with the real possibility it could worsen in our communities over the coming next 30 to 60 days.
Yeah, it's amazing how quickly this is escalating, and the plans that you have in place right now might change drastically. So talk about the first steps you took as part of the planning process.
Yeah, so Bill, first up, we really kind of thought about our priorities here. Exactly what do we want to do? What do we want to preserve? The first thing we thought of is our safety of our team, our patients, and the communities. I think as an organization, we have 800,000 patient encounters per year. And obviously the commitment to those and their safety is paramount for us. And then also we began to consider that as this unfolds in 30 to 60 days from now, we want to make sure our organization exits this event just as healthy as we entered. And so we began to think a lot about organizational continuity. We established a COVID-19 response team, really to create some plans around this with those three main points, specifically team member and patient safety and communication and business continuity.
So Dr. Eric, this next question is for you. Let's take each of those points that Bill just brought up one by one. Tell us about some of the work you've done on behalf of team members.
Yeah, so, initially what we looked at is we recognized that this was going to become an issue really a few weeks ago. And so starting 2 weeks ago as a clinical director, I was able to send out an email to communicate with our team members about what we were seeing and what we expected may come down the line, really starting with some of those PPE shortages and other things that we anticipated. But quickly we realized that email communication wasn't going to be enough. So we started developing, in conjunction with that response team, we developed a number of resources and protocols to really help address the issues that our team members were going to have. And then we developed an internal web page as well. So the web page itself is, basically houses now all of our resources. So some of the more impactful pieces have been a frequently asked questions section, a team member exposure policy. So specifically, the team will knows exactly what to do if there is an exposure, if they're having symptoms, or they notice any of those within their patients. So they have a very clear protocol there. We also have information on benefits for our team members, employee assistance programs, and our telework policy. In that website, we also have regular updates that we're putting there that is constantly changing. So supply and inventory updates, links to the CDC, educational videos, all of those kinds of things we're developing and putting there on a regular basis. We also have some incident reporting forms. And then finally, we have a box down at the bottom. It's kind of an Ask Dr. Tobler question. And that's been a great form of communication back and forth between our team members. So that's been pretty great. And then, for the communications, we've really tried to focus on a few things. One of those is just emphasizing the importance of our standard protocols for disinfection and sterilization, and just, emphasize that, but then also talk about at the office level how to strengthen the disinfection as well. So yeah, those are kind of the initial things that we've kicked off.
Okay, so that's really how you've addressed things from your team member perspective. Tell us a little bit about what Mortenson Dental Partners has been doing for the patients from the patient perspective. Right.
So the patient communication has really come from a few different places, both from direct communication centrally from the company, but then the more important communications, of course, come from the office level. So initially, we posted a statement on all of our external websites, and we sent an email to our patients to talk to them just a little bit more about what we're seeing and what we've done proactively to help maintain their safety and the safety of our team members, of course. And then prior to appointments, we've also sent out messages, confirmation messages like we would do normally, but also included some screening questions and asking patients who are exhibiting symptoms or who have traveled out of the country recently to push back their appointment for 14 days. And then, on the communication side at the office level, we have a counter display that really talks about those same things. If you had flu-like symptoms, coughing, shortness of breath, please delay your appointment. We have some pamphlets to just further inform them about what they can do to keep themselves, their families, and our community safe. And then we've also been balancing, openings in our schedule, trying to do what we can to take care of the patients today, because we don't know what tomorrow looks like. So our practices have been trying to look creatively at how they can take care of patients as well as possible, especially patients with emergency situations, patients in pain. We're really trying to do everything we can to take care of them today.
So this next question is really for Bill. So Bill Becknell, with everything that's going on right now and the fact that it's changing day by day, really actually more than that's hour by hour now, yeah. How do you ensure the continuity of your business? I mean, how do you ensure that things continue on in a reasonable manner?
So, Bill, we are, as a leadership team, we are meeting every day to review kind of the most recent events, the information that we're getting in from the practices, the statistics from yesterday in terms of missed appointments and cancellations, and then making plans and communicating that back out to our teams, as well as receiving the latest updates in from operations. It keeps us kind of informed, making decisions in a timely fashion and changing as this thing is changing rapidly, as you just mentioned. Each of our regional leadership teams, and we have 6 main regions out there, anywhere from 45 practices to 13 practices, and then each support function leader really is developing a contingency plan for various levels of impact. We kind of broke this down into 4 levels of impact, and that is, level 1, we're at 100% of operations. We're just being proactive in terms of education and communication. That really is where we are today as an organization. Then we said level 2 would be is operating at 75% of our normal operations, level 3 at 50, and level 4 at 25% and or below. And so for each of those levels, we've developed plans that we would execute as the business gets impacted. We're optimistic and hopeful that obviously we never get past level 1, but we want to be ready as the challenges come ahead. We're looking at different ways to consolidate practices in terms of a major downturn so we can still deliver care for those that are seeking it, and also manage the availability of employees that we have that are willing to and able to come to work. We're starting to create work from home for call center, insurance posting, and those types of things to make sure we can continue to support our practices through this difficult time.
Bill, what advice would you give to others working on contingency plans?
Kim, that's a really good question. I think first you have to keep your priorities in mind and consider your organizational responsibilities to really the larger good, specifically the safety of our patients, team members, and communities. As a significant provider of health care, we need to make sure that we're in a good position to protect the individuals that we serve, and then also protect our business. Now, a time of crisis really requires an extreme decentralized management approach to be effective. Your organization needs to be nimble, so you need to make sure you communicate the teams on their priorities, give them the tools to get things done and stay out of their way, because they will be needing to make decisions on the fly, especially as this thing unfolds and ramps up. And don't forget that everyone that you depend on is going through the same challenges. You need to think about how their unreliability can impact your business. Obviously, patients are going to be impacted, wanting to stay at home, wanting to not come in, not risk infection. Team members and providers are going to have, kids that are no longer in school who require care at home and are unavailable to work. Our payers are going to have the same challenges that we are, so you can expect your revenue stream to slow down. And our suppliers are going to have the same difficulty filling orders and making sure that we get the necessary supplies in a timely fashion to take care of our business. Obviously, you also need to think about cash flow. If the reports that we're getting out of China are correct, and we're going to have a significant depression in visits for the next 15, 30, 45, 60 days, cash flow really is going to be paramount in preparing for this event. And probably the good news to that is embracing the equilibrium. And in these events, it's real quick and easy to get focused on one side of the equation or the other, specifically either the supply or demand. The reality through these types of events is usually both sides of the equation is affected equally. And so as your supply of resources goes down, also the demand from patients will likely go down with it. So these usually will work, I believe, in somewhat parity as these things change. Communication, Kim, is absolutely critical, specifically from an internal standpoint, that everyone knows and understands what is going on, what the most recent changes are, and what's, we're looking for from them so that we can execute effectively as an organization. It's important to establish one version of the truth and really a reliable source for them to find that truth. And as Dr. Eric articulated earlier, we've created a website to do that, as well as a daily email coming from Eric with all the latest and greatest around the coronavirus. In short, in a time of crisis, really, the reality of it is we don't rise to the occasion. We fall to our highest level of planning. And so as an organization, we've worked aggressively to make sure we have a good plan in place to get us through this.
So Dr. Eric, what would you say the response has been to the communications and plans that you've put in place so far?
Well, I'll say this. I mean, Bill saying latest and greatest. That's the first time that I've heard that the communication about coronavirus from me has been the greatest. So I appreciate that. No, I think, there's really been a few things that I've seen. So being the point of contact, I've been fortunate to really interact with team members who are hearing, so much reporting both locally and nationally. And I've really heard a few things from them specifically about what we have going on in our practices. The first one is, specific questions about what do I do in this situation or that? And, what does this mean for my pay? What does this mean for my team members, how we're going to deliver care? And I've been grateful for the group as a whole. In general, with those questions, we've already had the protocols in place, and it was really just a matter of kind of validating the concerns of the individual team members and then referencing them to the protocols on the website I was talking about earlier, showing them this is where you can get your answers. And because like anything, it's sometimes hard to navigate and know exactly where to look for the information. So I've just been able to direct them in the right spots. The other half of the communication I've received from team members have actually been really fun. They've just thanked myself and the rest of the team for our proactive approach. And they've said things like, considering all of the things that we've heard, it gives us a lot of confidence to see that you guys are taking this seriously and that we as a company are getting ahead of it. I think that's been kind of the two main sources of communication that I've had from team members up to this point. And for me, it kind of demonstrates the value for us as a DSO, the value we're able to bring if we do things right. We can really help our clinicians stay focused on their patients and then provide to them directly the most current information that, as we said, is sometimes changing minute by minute. But we want to make sure that the information that we're sharing throughout the company is scientifically based and, supported by the best resources possible. But that's been able to allow, both our doctors and our teams to focus on the patient care while we as a company focus on building those contingency plans and protocols to help support them.
This is great info, and I know we just really scratched the surface with your process and what you have in place right now. Would Mortenson Dental partners be willing to share these insights to, as you know, we have a lot of emerging dental groups and larger dental groups and solo practitioners that listen to this podcast. I think that what you have in place right now is very forward thinking, and my guess is that there are some groups struggling to find the process. Would you be willing to share insights?
Bill, we would be, and we've had some requests from some of the past attendees at our Scaling Up Group Dentistry Conference, and we've already began to share this, so absolutely would be willing to do that with your followers, and really appreciate what you guys do in the profession to keep everybody up to date on the latest that's going on in the group space. So I think it's important to note we don't want to really give any advice here for legal reasons, but we're more than happy to share what we're doing. And please, whoever, reviews the information needs to use it at their own review and modify it to what best suits their organization. I think we've aligned for a website to be developed that you can go to. It's mortensondentalpartners.com/coronavirus, and you'll be required to enter some information and sign off on a non-disclosure or if you will, that, kind of a hold harmless agreement, but we're more than happy to share our information. And we really wish everyone the best of luck through this, and want to make sure that we all come through this as, healthy and productive as we can for our patients, our teams, and our communities.
Well, we'd like to thank Bill Becknell and Dr. Eric Tobler for joining us today and sharing so much about how Mortenson is responding to this pandemic. Your crisis management protocol is a great example for other dental groups and DSOs. The CDC actually recommends that everyone do their part to help respond to this emerging public health threat. And I think we did just that today, and we know the information shared today will help so many. So thank you again.
Kim, Bill, thank you so much for having us on the call.
Yep, thank you. It's a pleasure to be here, and as you said, it's changing so quickly.
The Group Dentistry Now show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today and please tell your colleagues about us.